Okay, preparing to live stream. Okay, we're there. We're almost there. Almost there, guys. Let me see if I can share my screen. What is it doing? Okay. Okay, so got it. Share the screen. Share. Slideshow. From the beginning. All right. Now, how do I know that? Now, is it live? I gotta see. Hold on. I'm sorry. I'm checking to see if it's live.
It's definitely live. I got a notification.
Oh, they can see us. Okay, we are here. Look at God working, and no one can see me right now. How do I turn on my camera? Okay, there we are. Everybody's here. Hello, hello, folks. Okay. So thank you for bearing with us. Okay, we are live right now, and I am here. My name is Danny. I'm on behalf of the Connecticut Breastfeeding Coalition, and we are coming together to discuss Black maternal health with these amazing ladies here. So I'm sorry if I keep looking down, I'm on my phone as well. So welcome. Thank you for joining us. We're going to be talking about how to support Black birthing individuals and their families. We're there. You guys can hear me? We're good?
Mm-hmm.
Okay. So on the agenda today, we are going to be, Autumn will start us off with the why behind Black Maternal Health Week. Shamika's going to discuss postpartum and periods, like menstrual cycles. Taylor's going to be talking about how to include dads. And I'll end it with more of the CBC's efforts on how they have, worked to dismantle racism. Okay. So let's get into it. So just a little bit about us. My name is Danielle. I am a LPN and lactation consultant. And my the name of my business is Milk and Melanin Lactation Services, and I have 3 children. I breastfed all 3 of my children, and that kind of helped me get into efforts on how they have the name of my. Can you? Yeah. This is kind of efforts on how they have. Yeah. Can everyone mute? Yeah. I'm sorry. Yeah, this is kind of efforts on how they have. Yeah, I'm sorry. Yeah, this is kind of efforts on how they have. I'm sorry, there's some feedback. Can you mute your lines? So there's some feedback. Can you mute your lines?
Danny, is your cell phone on?
No.
Okay. It sounded like it might have been.
Danny, is your cell phone on?
No.
Okay. It sounded like it might have been. Danny, is your cell phone on?
Okay.
No. Okay. It sounded like it might have been.
Okay. So I think we're okay now. So yeah, that's how I got my start.
Is your cell phone on?
Okay. So Autumn, do you want to introduce yourself? Okay. So I think we're okay now. So yeah, that's how I got my start.
Yeah, I certainly can. Hello, everyone. My name's Autumn. I'm very excited to be here with you all, honoring Black Maternal Health Week. I am a clinical social worker, a mother to my 2-year-old daughter. I am an evidence-based birth instructor, childbirth educator, and have worked in the human service field for about 11 years, really supporting families from at all levels throughout parenthood. And so I'm super excited to be here. I founded my business, Parent Technique, about 3 years ago as a way to address a lot of the gaps of services I was seeing in with families from the very beginning, from birth all the way through adolescenthood. And so I'm a perinatal therapist, so I provide therapy to families, within from conception throughout that first year. And I'm also an evidence-based birth instructor, as I had mentioned. So I'm really passionate, and I'm going to talk a lot today about childbirth education and other tips and tools to help ensure that, particularly if you are a Black or brown birthing person, strategies for you to be able to get really great evidence-based care.
Okay, I'm sorry about that, guys. I am trying to make sure that the audio is okay. Okay, say it again.
I said we got you, space and grace, space and grace.
Okay, yes, please, because I have never done this before. And it was giving me feedback because I guess the live is on my is on Facebook and with the Zoom. So Shamika, you're up next. Thank you, Autumn. I'm so sorry. I'm trying to manage this.
No need for apologies. Thanks.
Can you hear me okay? Do I sound all right? Am I loud enough? All right.
Thank you.
So, hi, my name is Shamika Frazier. Apparently, welcome to Wacky Tuesday. No, I'm just kidding. Gotta make light of the situation. I am a doula in New Haven, Connecticut. I am certified to do birth and postpartum. I'm also certified to help with breastfeeding consultations. I guess I'm like a baby because Connecticut have some very heavy stuff in vets in here, but who have done this for years and paved a huge way. But I am about 3 years in. I graduated from International Doula Institute in 2019. And towards the end of me graduating, I started my business, New Birth Journey. And which rolled me into 2020, which is wacky 2020 with all the COVID stuff. So yeah, perfect timing, right? But and then here we are today. I have 3 children of my own. Outside of being a doula, I am a full-time employee. So I do this doula thing, and I love supporting moms. I have so far supported about 5 to 6 moms and more to come.
Thank you for sharing, Shamika. So Taylor, you're up next.
Well, hello, everybody. It's a pleasure to be here. Danielle, thanks for having us. I'm excited to talk to you guys about the topics that we will be for Maternal Health Week. Like, this is perfect. I'm so happy to be here sharing space with my Black and Brown queens. So a little bit about me. I am a new doula and a new CLC. I have been kind of in the perinatal care world for quite some time now. And my own birth experiences were what caused me to create my business, Nourish Our Seeds. I have 2 children. I have 2 boys, a 6 and a 4-year-old, and they are wild and crazy and everything in between. Of course, loving and great and awesome in a lot of different ways as well. And they challenge me every day to evaluate gentle parenting and ensuring that I am trying to raise them as nicely and as kindly as possible with all the challenges that come with that. But I'm excited to be here.
Awesome. Thanks for sharing, Taylor. So this is the panel, and we shall be diving a little bit deeper into what we're going to be discussing today. So Autumn, you're going to be up next.
Beautiful. So hello. So it's Black Maternal Health Week. So I thought it would be great to start a little bit, talk a little bit about like why are we here? Why do we have this week? What's kind of the current state of maternal care? And then we will dive into some tangible, things for you to think about, but also strategies for you to actually like go and take and use. So why are we here? First of all, it's really important to recognize what the current state of maternal affairs is like in the United States. And unfortunately, in the United States, maternal care for all women is one of the poorest out of all developed nations. So that's all birthing folks. Okay. And then when we look at what those numbers look like for Black and Native American women in particular, the maternal mortality and complication rate is 3 to 4 times higher. 3 to 4 times higher. So that's really severe. And we've been able to, researchers have been able to take a look at this and even account for the differences in like education and finances. So what that means is if you were to take, a Black woman that had a master's degree, had a high income, and you were to take a Black woman that, maybe had a high school diploma as the education and had lower income, the rate of these disparities would still be the same. So a lot of times when we're looking at outcomes for health disparities, educational disparities, it's important to really factor in, again, education and money and access. And so even when those are factored in, Black and Brown birthing folks still have that really high maternal mortality rate of 3 to 4 times. So that's why, in a nutshell, why this week is really so important, not only to educate and elevate the voices of Black birthing folks, but also the beautiful work that a lot of Black and Brown people are doing to help change this around. So the positive is that we know that there are things that we can do, and we know that a lot of the deaths are preventable. Number one, it's really going to be important to look at, and again, I'll talk about shortly why, how we can reduce the amount of interventions that aren't medically necessary. So currently we have our birthing system in America is very, very medicalized, which just means there's a lot of intervention. And on one hand, it's important to acknowledge that the interventions we have also save lives, right? And are really important, and we're thankful for them. But the current state is that we overuse interventions when they're not necessary, which causes more trouble, right? Which causes more complications. So we need to lower those interventions, and again, we'll talk about some reasons and some ways you can advocate for yourself to do that. And then missed or delayed diagnosis paired with missed warning signs. So this is really, really huge. So missed or delayed diagnosis, we know, is a result of, unfortunately, racism in the system, and a lot of times Black birthing folks just not being heard when they voice a concern, right? When they voice that they're not feeling well, that's not being heard. And so we'll talk a little bit today, how you can advocate for yourself. And also missed warning signs by both patients and providers. And so again, that's where the education is super, super important. We cannot rely on solely just our providers, unfortunately, at this current state, because they're not all aware of current evidence. And again, we still have our medical system is still there's a lot of bias and implicit bias embedded in it. So knowledge is power. And so now I want to get into what are some things that you can do if you are a Black and brown birthing person or supporting a Black and brown birthing person. Awesome. So informed decision-making is key here. So when I talk about specifically those 3 ways that we can prevent, that the CD says that we can prevent these deaths, talking about decreasing interventions, focusing on understanding like warning signs, the only way you're going to be able to figure that out is if you are given information to make an informed decision about your care. So this acronym here, BRAIN, BRAIN, is the way that you can do this. So if you're listening, in your next prenatal appointment, if you're a partner and you're listening, in your next visit with your partner, if you're a midwife or a nurse or a student, be sure to go through this with every single anything that you introduce to your patients. So benefits. So if you are a birthing person, asking whenever something is presented to you, hey, can you tell me a little bit about the pros of this? What are the likely outcomes? Next is talking about the risks. Are there any risks for me? Are there any risks for my baby? Is there anything, knowing your particular health history? So you could say, is there anything knowing my particular health history, provider so-and-so, that would raise or lower my risk? So that's important to know, because oftentimes providers will give general stats, which is helpful to talk about the overall chance of an outcome for you. But also it's so important to consider that everybody's pregnancy and birth and health history is different. So asking specifically what are the risks for you is a really important question. A is alternative. So ask, hey, if someone's coming in and mentioning an induction, which is when there are tools used to start labor, when labor doesn't start spontaneously on its own, asking, hey, okay, well, what are the other options at this point? What are the benefits and risks of these other options? I is listening to your intuition or your gut, and nobody knows what's happening in your body more than you do. If you're a partner, right? The likelihood is nobody else in that room knows your partner better than you do, right? So intuition on both ends there. Listen to that. The doctors have evidence, the doctors have, providers have their information, but nobody knows what it's like to experience what you're experiencing. And that's a really important, in particular, when we're talking about identifying warning signs. So listen to yourself. And N is asking, well, what if we do nothing? Like if we didn't move forward with an induction, using that one as an example, what happens? Can we reassess this later? If I walked out of here today, would everything be okay? And could I have some more time to think about it, which is another thing. Unless there's a critical emergency, which providers will have no problem telling you, ask, or don't even ask, just tell them, I'm gonna need more time. There's also a method that you could use called the Ellis prayer method, which is you could just say, hey, you know what? I'd like some time to pray on that. Whether that is or isn't something that you do is entirely up to you, but that typically is something that works, and that providers will say, oh, okay, and they won't press, and they'll give you that time. So no, anything you do in life, I use this for decisions about like if I'm going to change my hair, seriously, BRAIN. This is the way to ensure you are given all the information, as the power is within you as a patient to make a decision. Okay, so next I want to talk a little bit about, well, hey, so you're listening and you're, a pregnant person, maybe you've tried to ask some of those things and you still feel like your provider's giving you resistance. These red flags are critical to know. If you are listening and you've experienced these red flags personally, if you know somebody that has, know that it might be something to consider, to possibly ask to speak with another provider, or maybe even leave that provider. Okay, these red flags are all indicators that informed decision making or informed consent for something. There's a good chance that it might not happen, right? It's your legal right as a patient to make informed decisions. And if providers are being defensive, belittling, showing signs of manipulation or avoidance, that's not giving you your right to informed consent. And I know the ladies on this call with me probably, have likely heard these examples that I have here. So an example of being defensive, if you ask a question and the provider's like, oh, why don't you think? Just trust me, just trust me. Why would you ask that if they're aggravated? You have a right to ask. They shouldn't assume that you know. You have a right to ask, and in a way that doesn't imply either that you're like questioning or don't trust them, but you have a right to know and to make a decision. So if you get a defensive response like that, let know that that's a red flag. Second, belittling. So saying something like, oh yeah, sure, that's a good idea. Or yeah, you think you're going to be able to handle that, but you're not. Putting down your wishes, putting down your birth values, whatever they might be, again, is an indication that their inclination is going to be to do what they want to do or what they think is best for you, not what is actually best for you and for your baby. 3, huge red flag, manipulation, right? So making threats, which again, unfortunately does happen, threatening a negative ending, saying things like, do you want to hurt your baby? Or, I know what I'm doing. Again, signs that they are not listening to you. They're going to act in a way that's doing what's best or what they think is best for you, what's really best for them. In avoidance. So this is a big one too. If you're asking questions or, you're calling the office, or you're in a visit, and they just seem like they don't have time for you, or they might even flat out say, and I've heard this, talk to so-and-so about this, or I don't have time, or someone else will review that. And you're like, you might be thinking, well, no, but you're my provider. Like, or you might be the provider that's at my birth. I would like to hear you. So if they're showing indications that they don't have time, that's a huge red flag that, again, when you need time, when you're in this most vulnerable space of birthing, that they're likely not going to give you that time. Okay, so truly supportive provider and birth setting matter. They matter so much. A provider that matches your birth values. So I want you to take some time, and if you haven't, I want you to think about the birth, and I want you to jot down 5 to 7 things that when you think about your birth, that are really important for you. Okay, those things are going to be your values in birth. Maybe there's a little less, typically not too much more than 7, but that's a good range. Okay, so provider that matches and acts in line with your values is the number one factor for your birth experience and having the outcome you want. Nothing else, just a provider that matches your values and your ideals. Okay, so is your provider one that takes the time to answer questions? Does their routine care, so the care that they're used to doing, that they could probably do with their eyes closed, is that the care that you want for your birth? Oftentimes, people pick providers, especially in our system, based off of practical things that we need to consider, like insurance, like geographic location, and like a friend, a recommendation. And those aren't bad things. Those are some of those obviously are important considerations, but those typically tend to be the sole reasons people pick a provider. And what we need to shift, so as consumers of the maternal care system, is we need to shift to picking providers that align with these values. Okay. And an example I share is, if you are someone that wants like a really great salad, or if you eat meat and you're craving, like you want like the best like gourmet burger, you wouldn't go to McDonald's for that gourmet burger, right? You could go, you might ask really nicely, you might get somebody that tries right, to like jazz up and make that McDonald's burger gourmet. But the chances of that happening, and the likelihood that you're actually going to get that gourmet burger that you're looking for, are very rare. And I say that, I use that as an example to say, typically people have an idea or a value of the birth, and they're going into our current system, which is in no way supportive of that, right? Or you're not given the tools to know how to navigate that. So identifying red flags, knowing that you can change your provider at any time. I've worked with families that change the provider at 35, 36, 37, 38 weeks. No problem, not a problem to do that. And using your brain, those are really two solid strategies, so that you're not going into having a provider, or you're not going into a birth setting that doesn't align, because that's where, again, we can get those outcomes in the beginning that we talked about, right, that are not great, and overall just have a less satisfying birth experience. And feeling satisfied with your birth, and particularly how you start parenthood, is priceless.
Thank you, Autumn. That was amazing. There was some serious technical difficulties. And I think we're like, folks can see us now. So there was, Autumn went through this amazing presentation on how to better support yourself and how your providers can support you. Feel free to put any questions in the chat. I am so sorry that, you guys couldn't hear her amazing presentation. I'm so sorry.
No, can you hear me now?
Yes, so we heard you, the panel, but it was not public.
Okay.
So I figured it out. But if y'all have any questions, feel free to put it in the chat. Please share. We are talking about Black maternal health and the disparities in how to better support Black birthing individuals. So we're gonna move it over to Shamika. And give me 1 second. Okay. Oh, I'm sorry. So yes, okay. So Autumn, do you want to just finish this slide?
Oh, yes, sure.
Yeah.
So I often hear and like to talk about how do I have a birth that aligns with my values? Like, how do I set myself up, for as much success to have a not only healthy birth and baby, but a happy, and that happy piece, again, so often gets left out and is so critical. So here are 3 evidence-based things that we know are really, really effective, and that I really encourage all families to look at getting for themselves. One is midwives. In all other countries outside of America, midwives lead care. They just lead care for birthing folks, and then in America it's rare that we don't. And we know that for low risk birthing folks, which most people are, midwives have much better outcomes, such as a decrease in preterm birth, decrease in miscarriage, decrease in stillbirths, decrease in episiotomies, decrease in perennial tears, decrease in inductions and other interventions such as like forceps or vacuum assisted delivery. These are statistically significant differences. So if you are at low risk in particular, really look at getting a midwife. Midwives also increase the rate of spontaneous vaginal birth, which again, we know has the best outcome for birthing folks and babies. They have the shortest recovery period. Birth satisfaction is higher. So midwives. Thank you to all of you midwives that are listening. Thank you to all of you future midwives. But if someone is to ask you, hey, what do I do? I'm a Black or brown birthing person. Get a midwife. Second thing I'm going to tell you to do, and we have two on this call, get doulas. For so many reasons, there's a whole laundry list. But the two big ones I like to point out are the decrease in cesarean by almost 40%. Decrease in cesareans by almost 40%. So again, there are absolutely circumstances where C-sections are necessary, right? But we know that they're happening most of the time now when they're not necessary. So it's just introducing a higher risk, right? So decreasing cesarean rate is huge. And also increasing spontaneous vaginal births by 15%. Huge numbers. We know that they also increase birth satisfaction. And are really there. I mean, the emotional support, not only during the birth, but even before, and preparing partners is just invaluable. So midwife, get yourself a midwife, get yourself a doula. And last, but certainly not least, and this is something that gets left out of the conversation a lot, is the importance of comprehensive childbirth education, right? So this is not like your 3-hour hospital class. All that covers, or wherever you're giving birth. That typically just covers what is the process, and like maybe they'll talk about an epidural. That's it. That is not a comprehensive childbirth ed. Comprehensive childbirth ed really looks at communication, right, in labor. It talks about how to advocate for yourself. It talks about comfort measures outside of just epidural, but the range of comfort measures and how and when to use them, and the evidence on common interventions in birth. So comprehensive childbirth ed has been shown to decrease the need for newborn resuscitation, increase the rate of spontaneous vaginal births, decrease perineal trauma, again, which really can have a huge impact if there's perineal trauma. So decreasing that is really important. Decreasing episiotomy rate, again, it goes hand in hand with the perineal trauma. And on average, decreasing the pushing or the second stage of labor by about a half hour. 30 minutes, that's a long time. That's a long time. So I really encourage you, if you are a birthing person, to not only get a midwife, but a doula, take a comprehensive childbirth class. There are doulas that offer these childbirth classes. I also highly recommend evidence-based birth. Like I said, I'm an EBB instructor, so I offer classes, but there's a whole range. There's so many people that offer this type of comprehensive class that covers communication, advocacy, and comfort measures and things like that. So those three things I kind of look at as golden tickets.
Awesome. Thank you, Autumn. So I had a couple of questions, and I wanted to ask you, in as far as all of these different types of decrease, like these different interventions can be decreased, right? What I kind of want to know more about the VBAC. Like, how does that work? How can we kind of ensure that the mom safely has a VBAC?
Yes, so that's excellent. That's an excellent question. So number one is going back to the whole concept of a provider that aligns with your values. A lot of providers be like, oh yeah, VBAC. But if you were to ask them, how many VBACs have they participated in? How many were like, how many were successful? How many people ended up having a trial of labor, and then how many ended up giving birth? And that number typically is very different. So if VBACs, we know, are really safe options for the majority of folks. So you want to find a VBAC friendly provider. Generally, a general rule for that is someone that has a 60% plus success rate with VBACs. In Connecticut, there are two Maybe I can put them in the chat, but I know particularly we have 2 or 3 practices in the state that have a very strong, like, this is what they do. And so again, this goes back to the model of oftentimes if you back a provider will be like, oh yeah, we'll consider it. And then, they're already talking about pushing for an induction or pushing for a C-section, by 36 or 37 weeks. So really take the time to ask your provider now what their VBAC success rate is, what would be the deterrence, right? And at what point for saying, you know what, a VBAC, might not be the best option when you talk about weighing the benefits and risks. Absolutely have a doula, because oftentimes, even with trial of labor, so if labor, does spontaneously start on its own for a VBAC, because VBACs tend to take a little bit longer, the risk of being diagnosed with failure to progress can happen sooner, and often not when it's really a failure to progress. But again, that's where having a doula is going to be super, super helpful in the room to help advocate and help give you some positions to help things to progress. So VBAC, successful VBAC, the name of the game is really finding a provider that, like, this is what they do. They've done this multiple times. Again, their success rate is around that 60% mark. I also encourage you to check out read. There's the VBAC Companion is an excellent book, and also VBAC Facts is a really great resource as well. Great question, Danny. Thank you.
Awesome. Thanks for sharing. And I really appreciate you taking the time to answer that, because I never really knew what they could expect. So that would kind of help me with some of my prenatal clients as well.
Awesome.
Yeah. All right. So if y'all have any questions, put them in the chat in regards to evidence-based birth, childbirth education, how to read what a doula is, what's the difference between a doula and a midwife. If you have any questions pertaining to that, or VBACs, or, lowering the rates of some of these interventions, put it in the chat. We're going to move on with Shamika's presentation. She's going to be talking about postpartum and periods, the menstrual cycle.
So, hey, my name is Shamika. I own New Birth Journey. I am a birth and postpartum doula, as I've mentioned before. So I'm going to jump right into us learning about postpartum healing and the periods. So a couple of things that I pulled out were that postpartum is defined as the segment for afterbirth. So on one hand, you have it defined as the segment for afterbirth. On another hand, usually when you hear about postpartum, it has a lot to do with mental health, in which you hear about postpartum depression and anxiety, which I will go over a little bit here. So your postpartum can last from 4 to 8 weeks, sometimes 12. Some people go a little further with the length of time. Everybody's body is different. So you got to definitely consider that fact that, maybe your friend was only 4 weeks of a cycle right after birth, or maybe someone else was just 6 weeks, but you may be 12 or less than that or whatsoever. But if you have any other questions, definitely talk to your OBGYN or your midwife. Next is, please, be aware of clots the size of a golf ball. So you want to be mindful of your clots and what's coming out of your body. And you want to make sure that if anything concerning that you see a different color, really, really dark blood, or a different color discharge, because there is a level of discharge that happens after birth called, I want to say it's called Lucia. or I could be saying it wrong, but it's a discharge that happens after birth. It's part of the lining. But if you do have clots that are about the size of a golf ball or clots that are concerning, then you definitely, again, want to be in contact with your OBGYN and your midwife. Next is breastfeeding can be a benefit to your postpartum healing because the process of your uterus contracting back down to its original size. So because you are breastfeeding, that cause the suckling of the baby causes you to have a contraction or a cramp or however you want to word it. But while your uterus is pulling back in, which can help with that healing process and may help it go by a little bit quicker. According to March of Dimes, you lose by about 500 to 1,000 milliliters of blood. So it sounds like a lot. Don't freak out, but you got to think this is over a course of time, over a course of, like I said, the 4 to 8 weeks, or maybe even the 12. Many companies have postpartum kits with pad sickles. So pad sickles is a pad, and you will take the pad and you will put aloe vera gel, and you got to make sure it's non-scented because you don't want to set off your pH balance. Also, you want to use a non-alcoholic witch hazel. So what it's supposed to do is, some people like the cool sensation of it while they're in postpartum to ease up on some of that pain that they're going through. Some of the postpartum kits come with meds like Tylenol, like regular over-the-counter stuff. Some of them come with panties. There are, like, I think Thinx is the company that make like postpartum and period panties, which you don't have to have a liner in it. It's kind of already built into the underwear. And it can save you money in the sense of having to go out and buy sanitary pads all the time. You can just rewash, the underwear and keep it. As well as, I want to put this tidbit in here, be mindful of the pads that you use, because a lot of these big brands have a lot of perfume chemicals and cancerous chemicals in their pads that causes our pH balance to go off, skin irritation and all kind of stuff going on down there, and which that you don't think about because we're so used to these big brands and buying them all the time. Oh, girl, just get, the Always brand, da, da, da. Try to go for something that has no scent, that has no extra anything in there. There are people that hand make pads with regular cloth and other materials, and they sew it all together and they actually sell them. Who, I particularly don't know, but I'm sure that you can Google it and find people that actually do it, that just sew it, and they find it more convenient and more easier because, like I said, you can take these things and just wash them, just like cloth diapers. Like, you could take them and wash them and reuse them for your next cycle. Moving on, so you want to create a postpartum plan. Everyone talks about a birth plan. We hear a lot about a postpartum plan as a doula, but you want to think about a postpartum plan as well as getting in contact with your village. You want to talk to whoever closest to you, your mom, your sister, your brother, your cousin, whatsoever, and start delegating or regulating in a sense of telling them, hey, I need you to help me with this and that. I need you to help me put my feet up. I need you to help me, with the baby or bringing baby to breast. It's important because the better you heal in your postpartum, when you get past that sector of time and you start to feel that level of normalcy, and I say normalcy with quotations because everyone defines what feels normal to them differently. So what you may feel as normalcy for yourself, you will have to, get prepared by taking care of yourself in that postpartum. and in that healing that you're doing during your postpartum. So next is, like I said, looking into getting support from your postpartum doula. So I am a postpartum doula. But you want to look into whatever postpartum doulas may be in your area, no matter where you are, where you're from. I'm pretty sure somebody will pop up because there's so many. But you want to look into having one, because what they will do is, or what I will do is, come into your home. We will figure out what your plan is, your postpartum plan. We will look at, the village that you have and see how we can make it accustomed to you. It may be, hey, you just need a couple hours of rest. So I may stay up 4 to 5 hours with the baby while you get some rest, on top of while baby's down for a second. I may wash a few bottles out. So when baby's ready to use them again, maybe you can have them. Throw a couple of blankets in the washer and dryer if that's what you request. It's really accustomed to your needs and to provide you comfort, so you won't have to do as much. I think we as Black women often tend to want to do a lot, and we don't really give ourselves enough grace. So to think about a postpartum doula after you have birth may be a huge help, and help you mentally and emotionally as well, because it's one less thing on your shoulder or thing to think about. Next is, ask your provider about information regarding postpartum depression, anxiety, postpartum alopecia, and more. Some people, because of all the hormonal changes, lose their hair behind having a child. They find out later, especially if you think about it, you done gave out so much giving birth, like you done gave out all you got. So you got to replenish that with nutrients, vitamins, and hydrating, and also that peace is important. So you could go to the next slide. Danielle, next slide. Okay. Next is, because I'm also talking about periods as well, because postpartum and periods go hand in hand. So some things to think about, rather if it's either or, is tap into womb healing. You are experiencing so many emotions during this time. This is the perfect time to tap into your mental and your emotional, your traumas and more. Make space for you. So womb healing, a lot of people that live in the holistic lens say it often about womb healing. You may hear it close when you hear about yoni steaming and all that other stuff. So what I have found that womb healing is definitely being able to make space for you, your time, and your body. How many times have we had kids or babies, and we go through that phase of, I don't like my body, I don't like this cellulite, I don't like the way this stomach look, this little fupa part, and we start cursing our own body, we start trash talking ourselves. First of all, let's pause all that and really make a space for ourselves to start saying, you know what this body just did? This body just brought life into this world. I just added to the population a superstar. Like, I am great. I am amazing. Rather if you had a C-section, or vaginal delivery, you did that. Like, so, and you're about to raise one of the greatest humans ever. So with all that being said, we need to start making space for ourselves, to appreciate ourselves. It's not too many times that you hear more stories, I feel like, than about negative experiences after, like those negative feelings, those, and I don't really want to say they're negative. They're true feelings to how you feel about yourself, but they are feelings in which it's so common that so many share, like, oh, like, again, oh, my stretch marks, oh, this, oh, I'm never going to bounce back. Oh, I just want to look like Beyonce or something like that. Like, it doesn't necessarily work that way. And it's okay. Honor your body, love your body. Yeah, you may have to diet. You may have to get up and exercise. you may have to take the time out to really plan that and make a commitment and a deal with yourself. Like, you know what, in the next 6 months, all I'm gonna try to lose is 5 pounds. And then 6 months after that, I may go for another 5. That is okay. This is your body. So the better you treat your body, especially in your postpartum, especially even around your period, we forget how we curse our name when we have a period and we go, oh, this bloating, oh, here we go again. Here come Eve with her apple head self. Like, it's our body. So you got to start thinking different about how you feel about you. Tap into yourself. Also figure out why you feel this way about your body. You've been, I would like to say female or female affiliated more than anything for the majority of your life. So let's figure out, why do you feel this way about your body? Is this something that you heard when you sat at the table with your grandmother, your mother, or whatsoever, how they talked about themselves? Are you picking up what you've heard? So it trickles down, and then it stays in our mind like, oh, you know, this is kind of like how I'm supposed to feel because they felt that way. So with that being said, it's definitely tapping into your inner self. Moving on to rest is essential and necessary. So there is PD Jake's daughter has a whole segment about Girl Get Up, and it's called Girl Get Up, and she's encouraging women to get up. But as a doula, I say, girl, sit down. Not get up, sit down. Sit down and stay still. You don't got to do everything all the time. Give some people some jobs to do to help you get through this time. This is time to, like I said, dig into your inner healing. This is time to put your feet up. This is kind of time to be selfish, right? And it's warranted. You, like I said, you just brought life into this world. You just did a lot. Your body just did a lot, you know? So rest is essential and necessary. Next is the cervix is open. So whether if you have a period or postpartum, your cervix is open in different ways. Your cervix is, of course, more open if you're in postpartum because you just had a baby come through. And your period, your cervix opens, you know, to maybe a centimeter, not too much, in which your lining has to shed through. That's how it passes. So yeah, your cervix is open. So you want to be mindful of what's going in, out, and around down here. Even when you think about like tampons and stuff, like you want to be mindful of those things because you can risk infection. Especially, say if your hand's dirty, you put a tampon up there, it done touched your hand, and yeah. So nobody wants to go that route. I'm sorry, I'm almost done with this slide. Next is you may ovulate. So, okay. So all the people who enjoy doing the do and they magically end up pregnant around their periods and postpartum and they don't know how, because you may still be ovulating around that time. Even when, especially when you get towards that end and your body's about to transfer over into a whole nother segment and cycle. So be mindful of that. And warm foods, especially hearty stews, are recommended for digestion and blood flow. Put something warm in your belly. I wouldn't say reach for the cheeseburger and the steak off rip because that's what you're craving. Try a beef stew then. Try a chicken stew. Try some soup. And I know it don't sound so glorious and sexy as eating a huge chocolate bar, but try that, because some of that bloating you're feeling, some of that gas that you're feeling building up in your belly, some of that indigestion, some people get real nauseous around that time you're feeling, is partly because of your diet, what you're putting in your body around that time. And it's bad. America is bad for influencing us to pick up lots of sugar, lots of fatty things, or whatsoever first. So our craving goes to the first thing that is home to us, which is sugar and fatty things or whatsoever. Try to put something more whole and hearty. And when you make a soup, you tend to put more herbs, more veggies, more And then so you get more nutrients, more vitamins, more easier to nourish your body. And if you have to pass anything through your digestive system, it's easier to pass when it's already kind of softer already. Next is try to avoid anything that you would usually upset your stomach, because during this time, your stomach is sensitive. Your hormones are all over the place when you are in postpartum and in your period. So with that being said, you want to make sure, listen, if you couldn't eat a bowl of ice cream before you had your period, why are you going to eat it on your period? Why are you going to do that? You're going to bring in that gas and that uncomfortability that I was talking about even more, especially with your body being more sensitive. So you got to be like, okay, let me put on my big girl panties, fight back on these cravings, and just be like, no, not right now. Or you better have the meds you need that's going to help you right by your side. Next, your pH balance could be off, so pay attention to your hormone levels. So yes, during those times, there's a lot going on. Blood can be acidic. So with that being said, it can throw off your regular everyday scent or smell or whatsoever. Again, it's a lot factoring into that. It can be the pads throwing you off. It can be your diet throwing you off. It can be anything that you maybe put in near or around that, perfumes, soaps, and all that. You could go to the next slide. So last round, and it has some fun facts on it as well. So it says periods may change course and heaviness after postpartum. So again, everybody's body is different. So your period you may end up, say your cycle ended from postpartum earlier in the month, but then at the very end of the month, which may not be your usual time that you have a regular period, your period may show up, or it may not show up at all, and it may run into the next month because it's towards the end of that month. So they can vary. Get you a journal to write these things down as your body's going through these transitions and changes for your postpartum, for your periods, even for your birth, for you when you talk to a doctor, write their name down, write the date and the time. My grandmother taught me that, very old-fashioned, but write their name, the date and the time. That way you could say, I spoke to so-and-so at this time, and they said to me, or I had a question about, et cetera, et cetera. Get you a journal, make you a PMS journal, a period journal, a vagina journal, whatever you want to call it. Make you a journal that's about your lady parts, because as a lady or female associate, you your body goes through so much at one time. It goes through a lot. So from ovulation to your actual cycle to after, journal those mood swings, journal those cravings, even some people start a diet journal to match their PMS journal, because of the simple fact you want to start tracking what you may be putting in your body that can be, like I said, throwing off your cycle or changing up your moods. And sometimes what you eat is how you feel. It ties into our mental a lot. So you want to think about that as well. If you're feeling bloaty and yucky and stuff inside, how you think you about to treat everybody else outside that? You about to be annoyed with everybody. Get away from me. Don't touch me. I'm aggravated. Pineapples. I'm uncomfortable. With that being said, just pull out a journal and just write it all down, but just make it about that. So that way, when you go to the OBGYN or when you go for your visit, you could be like, this, and that happened. This is how I was feeling. This is what I noticed. Hey, can you help me? Which would give them more, information on, okay, how to get a better diagnosis for you before they just, as Autumn was saying before, there's a lot of misdiagnoses that happen with Black and brown and women. So to get a better one, sometimes having that journal helps out a lot, because then you don't have to be like, I don't remember when. You have it already written down. Next, the length of the period may be shorter, even sometimes longer, depending on your body. Again, periods are month to month usually. So you can do some womb healing month to month, if you like that idea. South Korea, Japan, India, Indonesia, China all have menstrual leaves, and they all vary in duration. I think in certain countries they get 3 days off for the women in that country. Some have 5 days off, some have 7 days off, but it is also a part of their health plan. And then next is the first moon party. So a first moon party and a period party is for the younger ladies, right? Because when we are younger ladies, we tend to, so little girls can start having their period as early as, I want to say about 7 or 8. Very, very early, right? And the first thing we do is get scared. I know 12 is more of the common number, but there have been enough cases to say 7 and 8 is very valid too. But so what happens is they tend to be really nervous, and even parents be nervous about explaining this whole situation and what's happening to their body and their cycles. So what has happened in other countries, cultures, and even starting to show up in America and here is first moon parties or period parties, which you will bring things like wine, tampons, pads, and stuff like that, maybe herbs or whatever else, depending on your culture or background whatsoever. And you would teach the younger ladies or younger girl about her body and what she's going through. You also will empower and encourage her on her cycles and her process. Okay, let's move to the end. And it says, did you know in some cultures and religions, a woman is to sleep in a separate room from her husband while she's on her period? And in some religions, she's allowed to take from certain religious practices during this time. So some cultures I have read, and I've actually got to speak to people in person about, sometimes they have been told that they got to sleep in separate rooms, especially like if they're married, they have to sleep in separate rooms. So I found that interesting to share. And then in some cultures, they take off time to from religious practices. I want to say, and forgive me if I'm wrong, in Muslim culture, when they go to, I want to say the mosque, if the woman's on her period, she does not have to go. In some countries, it's like that, and they really give her a break, give her a rest around that time, which I thought was kind of neat and kind of fascinating, especially because, like I said, there's a lot of things that happen amongst the world when it comes to periods and postpartums that are different from here. So I thought those were cool facts to pull out. But this is a big, because it's the postpartum healing for me. And that's on period. So it's a new way of using that phrase. You like what I did there. But that is my time. And I think we're going to move on to the next presenter. Thank you. If there's any comments in the chat, I will try to answer them in the chat like that, so we could keep moving.
Awesome. Thank you, Shamika. We did have a couple of questions. One of them was, can you conceive if you haven't gotten your period back? And I wanted to know your thoughts on this and what you've heard in regards to that.
So can you conceive? I'm assuming, can you get pregnant? I believe I said that you could. I'm sure if you could ovulate, you could conceive. So yeah, you could go ahead and some people notice, because what will happen is, like, for example, they will have a normal period, say their period is 5 days. All of a sudden, it's not 5 days no more, it's just 2 days. It has been shortened because you might be pregnant. So, and then some people double check with that because they'll wait to that next cycle if you're regular. If you're not, I know for some people it is hard for them to be able to tell because their cycles are irregular. But I would definitely say if you start feeling those changes, like the swollen breast, and you start feeling, a little more nauseous out of nowhere, yeah, go ahead and go pee on a stick and then get it verified by your OBGYN. So yes, my answer is yes.
Awesome. And one more question. Do you recommend like a sitz bath? Do you still is that would that still be considered part of the postpartum period? Like a
Yes.
part of the healing process?
So some people do the sitz bath and some people don't want to. And I know that some people do sitz baths because some people like to put the herbs and stuff in it. Again, mind your body in the sense of it's your body and what you're comfortable with. Like, everyone's not comfortable with the same thing. There's some people that'll say, yay, do the sitz bath. Some people may say no, because again, like I said, some people like to put herbs in their sitz bath. The sitz bath is supposed to help in your postpartum and with your sorry, I muted myself. Another thing to soothe yourself, that's also why some people do the Yanni semen, or they'll try to do it like right at the end of a postpartum period, or a period, sorry.
Okay, and so I think we wanted to just mention like the sitz bath is, the warm water with the, is it in the basin and they're sitting? I mean, when I did it, I was sitting on the toilet with the warm water, just kind of the steam, just kind of, helping with the healing process. Is that correct?
Yeah, so it's like a warm, shallow, I guess, bath, if you want to say, designed for your your lower part. But yeah, so it is basically the same thing. And like I said, it's kind of close to how like a Yanni steaming works, where if you look at the Yanni steam setup, it kind of looks like you're sitting on a toilet in a sense. But again, and be mindful of, if you do use herbs for anything, first of all, talk to herbalists about whatever herbs. Your herbs should be accustomed to your body. So be mindful. I know people like racking up on Yanni steams and the herbs and the bags and stuff like that. But you got to think, these are people who probably just found a couple of herbs that work and they kept the same process over and over, and they're shipping it out to you. Talk to an herbalist first to find what your body personally needs, because everyone struggles with something different. You may have endometriosis and may need different things in regards to that, PCOS or something like that, a cyst. So just be mindful of doing that as well. And that's why some people say, yay on a cyst bath, yay on a Yanni steam, or no. So just, it's all about educating yourself and being tapped in and in tune with yourself. Like, you are your number one star player of what's going on with you.
Awesome. Thank you so much, Shamika. That invaluable information. And that's on period. We are going to move on to Taylor, and she's going to be sharing how dads could be included in the postpartum period.
Hello guys, again, I'm Taylor. I'm the owner of Nourish Our Seeds. I am a full spectrum doula as well as a certified lactation counselor, as we talked about earlier. And I wanted to talk about a topic that kind of gets neglected very much during the labor and delivery process as well as pregnancy. And that's dad. It's no secret that dads can get completely overshadowed during pregnancy and especially during labor for reasons that make a lot of sense. But more often than not, dad is left lacking attention most times. So I wanted to talk to you guys about the importance of keeping dads involved during pregnancy and labor. So we know that birth and all things related is a hormonal process, We know that moms go through significant hormonal changes during pregnancy and into the postpartum period. We know that oxytocin is known as a love hormone. It helps to regulate contractions, which is very important. It's the reason behind most of the feel-good sensations in our body. Beta endorphin are naturally occurring opiates in our body. So they help to restore homeostasis. Obviously, when you're in labor, your body's like, oh my gosh, what is going on? Pain, this is crazy. So beta endorphin actually helps to get your body back into, as much as possible during labor, a state of just being balanced. And that's what homeostasis means, literally balance within the body. It also induces feelings of pleasure. So that euphoric feeling that you feel in your body is most likely because you're experiencing the release of beta endorphin hormones. Another very important hormone for labor and delivery, as well as into the postpartum period, is prolactin. It's known as the mothering hormone. It's the hormone that's responsible for essentially causing moms to put baby's needs before all else. It's also key to milk production after you deliver your placenta. And it has a major influence on the function of the immune system. We can go to the next one. So we also know that with new studies that dads actually are experiencing a hormonal change as well. The two major hormones that dads we see a change in during pregnancy for dads is testosterone and estradiol. Both of them are very closely linked to aggression as well as sex drive within the male body. And I kind of want to ask you guys, like, why do you think it might be important for a dad's aggressions levels to drop? Clearly, we need men to be more gentle and nurturing during the postpartum period to care for a new mom and baby. So it's important to note that while this is still being studied, we're seeing that dad is also experiencing changes to prepare for baby's arrival. So dad definitely plays a part. This is definitely a emotional process for dad as well. I may not show in the same ways, but again, the science is starting to show that dads are also, like I said, going through a change in their bodies. So we want to make sure that we're catering to them and tending to them and paying attention to them and informing them as well. We talked about the role of oxytocin and the role that it plays during labor. So when oxytocin is high, mom is going to experience powerful contractions, which helps labor progress, amongst several other benefits. Well, in my role as a doula, I found that dad's presence can play a role in increasing the oxytocin levels. We know that our men to be our protectors, and when mom feels safe, those oxytocin levels are going to rise naturally. So dad being involved is beneficial in that way. A grand midwife pro trick that has survived all the traumatic events that we've endured is to put dad's hat on mom to jumpstart a stalled labor, right? So again, without knowing all the science behind that, my ancestors knew that dad's scent essentially would increase those oxytocin levels and be able to progress labor. So how do we get dad involved? I would say the biggest thing is to keep dad close, honestly. What that looks like during labor and delivery. You can work dad into different positions that require support. So one of the first positions that come to mind where you might need support is squatting, right? When you're squatting and you're in labor, you're gonna not really have the best balance, and you might need some support, right? Have dad be almost the wall that you're kind of holding yourself against. Another way is to hug as much as possible. Hugging during any time naturally increases those oxytocin levels, right? So bring dad in, hug him, rock with him. You can, do some hip wiggles, just anything you can to keep your body moving and keeping dad close. Like I said, those oxytocin levels are going to go up and those contractions are going to be powerful, but they're going to be more effective in that way. Another way, even before we get into labor and delivery and into the postpartum period, I think it's very important for women to involve dad in creating their birth plan for a couple of different reasons. One is that by involving dad in creating the birth plan, if anything is happening that you can't advocate for yourself, your partner in the room with you, specifically most likely dad, is going to be able to say, hey, we don't want X, Y, and Z to happen. He'll be able to advocate for you in that way if he knows what you want. So you want to make sure that he is in the know in that way. So let him come up with a birth plan together with you. The other reason behind that is also it allows dad to have some knowledge. A lot of times men aren't educated. Women at this point, you know, it's few and far between as well. That's why it's important to have a doula. And again, as Autumn mentioned earlier, to vet your birth team so that you can ask questions and you can be informed to make informed decisions. But men don't get that same treatment. So we want to make sure that going over a birth plan, essentially, you can kind of educate your partner in that way. So make sure that they're involved in those steps. Like I said, it's very beneficial in a couple different ways. Another way is to sign up for my birth partner training. I have recently implemented a training in which I am trying to help dads feel more confident in their ability and their knowledge base to be able to effectively support their partner through labor and delivery and into the postpartum period. Another way to do that is also, as Autumn mentioned, a comprehensive childbirth education program. You just want to make sure that you have the knowledge, and you want to make sure that you kind of know the knows to know to be able to, again, make those informed and empowered decisions. So yes, so let's keep dad close. Let's keep him in the know. I'll say very jokingly, but you know, if dad knows what's going on and what to do, that's less work for you in a lot of different ways. Like, you know, we need to be able to put these men to work to be able to help. But in order to do that, we have to educate them and we have to empower them. So don't forget about dad. We need to include him in this process. It is something that's important to him, and it will benefit you in the long run as well in terms of having a support person.
Awesome. Thank you so much, Taylor. That was amazing. I really am always an advocate for including dad, and definitely try to get them in on the prenatal visits so that they can learn as well. And your training, is that a virtual training or in-person training?
So as of now, it is in person. I'm doing it that way for the biggest reason, honestly, is because during this time, like during this training, we do a lot of hands-on practice on mom physically. Like, I think by doing it that way, obviously it's going to boost confidence. They'll feel more like confident in their ability to actually do the maneuvers. Like, for instance, we go over double hip squeezes, counter pressure. It's hard to kind of teach that virtually. So as of now, it is being offered only in person. That may change depending on the demand. If I'm starting to see that people want to do the class outside of my service area, which I didn't mention, I service New Haven for the most part. I'll go into the greater New Haven County, but for the most part, I'm stuck right here in my little bubble, and I'm okay with that. But if I do see that there is a greater need, I will indeed start thinking about virtual ways in effective ways to be able to teach the same things. But for right now, like I said, in person, just so you can get that hands-on experience and really feel confident in knowing what you're doing and knowing what we're talking about. I also would like to note that doing the training allows me to be able to virtually coach someone with COVID restrictions and how the hospital policies are constantly changing with how many support people you can have. It helps to have someone who knows my language, essentially. So if you partake in my training, for instance, I'll be able to say, like, let's say, God forbid, I can't make it to a birth for whatever reason, right? I'll be able to say, hey, dad, it looks like she's having some back pain. Let's try to do some counter pressure. And dad's going to know, all right, get that counter pressure, know where to go, know where to place the pressure and things of that nature. So it's something that I'm offering, and I'm hoping that people take part in, because if you can't necessarily afford a whole doula or whatever it is, we try to be as accessible. I'm sure I can attest for everybody on the panel. we try to make our services extremely accessible, but it is sometimes hard, you know, people go through things. So this allows for your partner to be able to at least know the basics of support during labor and delivery.
Awesome. I have one more question about the training.
Yes.
Will you be offering it as a group training, or like where maybe a few couples can come and learn, or is it just strictly one-on-one?
It can be offered as a class. So far, I haven't had like a bunch of people sign up at the same time. If I do have something like that happen and it's feasible for us to all meet somewhere, absolutely, I would do it as a class. But as of right now, just because of demand, it's just been one-on-one. But I am definitely open to doing full-on classes, depending on how many people sign up and stuff.
Awesome. Thank you so much, Taylor. Oops. There's so many of us on now. So we're going to move forward. If y'all have any questions, definitely put it in the chat. And I'm going to end it with the CBC's efforts and what they have done to dismantle racism in the breastfeeding world. Okay, so they've invited, let me turn my camera on, I'm sorry. Hey there. Okay, so they've invited historically marginalized folks to join the CBC's board of directors. So I am one of 7 BIPOC CBC board members, and there's 15 members on the board that hold seats. And so there's also learning opportunities through SERPs. So being very specific with the different types of SERPs that we've applied for. And one of them is the Great Lakes webinars and the dismantling racism and implicit bias in breastfeeding and human lactation that was facilitated by Tanifer Camara, and she's an IVCLC. And also Shantae Gatson, she is a Black IVCLC in Savannah, Georgia. She joined us last year to share the steps on how to become a lactation consultant. Here in Connecticut, I am what we believe to be one of 2 Black lactation consultants. So we're really working towards that and supporting historically marginalized people that are entering the profession. We have some scholarships that are, we've had scholarships, and I was actually one of the scholarship recipients. There was 6 of us that received a scholarship from the CBC to help us with some of the costs of becoming a lactations consultant, because it is pretty expensive. The test itself is $660, and that's not including books and different trainings and everything else that we would need to move forward. So that's how they've helped in the past. And in the future going forward, they're hoping to increase and retain BIPOC members. So it's pretty much the same thing as just kind of keeping those steps moving forward. Learn more about white supremacy and implicit bias. And so focusing on those efforts and how to reduce those different disparities in the lactation field, and how we can kind of move forward and getting folks to address their bias, honestly, because if they have that, racist, attitude or those different biases off the bat, they can't really service Black families the way they should, the way they would service any other family. So working towards that, and also partnering with the Department of Public Health in their SPAN grant to support people that, identify as BIPOC or LGBTQ, Latina. Latinx on their lactation journeys. So we have currently, we're working on helping other Black lactation professionals like maybe Taylor or Shamika that are CLCs, they're certified lactation counselors, they're doulas. Some folks are licensed clinical social workers, and we're working to help them move forward and become lactation consultants in the lactation field, and really just kind of trying to level out the playing field so that families of color can get the culturally relevant care that they deserve. You know, honestly, folks can address the biases all day, but it's a cultural thing. And the same way an Asian woman would deserve an Asian provider, Black women deserve to be able to have the option of a provider of color. So I am going to stop sharing my screen. And we are done. That concludes our presentation. Thank you all for joining us. We are so grateful. It was a trying time trying to get on here, but we made it through. And I'm so grateful to all of you guys that tuned in. And I'm so grateful to the panel for hanging in here with me. If y'all have any questions, or if y'all see any questions in the chat, let me know. Or if y'all have any questions in regards to the CBC's next steps or anything, go for it.
I don't have any questions. I just want to say that this was tremendous, and it's so great to hear both of you just talk about both of the areas that you covered, just like so in depth, and so I'm excited to be here and to be a part of this. So thank you.
Thank you. I really appreciate it. It was really fun. I really enjoyed all the different aspects of, because Autumn is a social worker. Shamika and Taylor are doulas, but y'all do different things and y'all work in different capacities. So I really appreciate just hearing more of the different dynamics. And that's why I really wanted to put this together. So that concludes it. I'm just trying to see if there's any questions. We can stay on for a little bit. I don't want to hold you guys.
Danielle, I was looking in the chat, and someone asked if essentially eating and drinking will affect milk production, and I wanted to address that. I know you my IBCLC queen, but I wanted to just mention and fill in if you need to, if I say anything incorrect. But I wanted to just let everybody know who's listening that it is not actually, nutrition is actually not linked to milk production. The way you make milk is by getting the milk out, right? So if your baby is at the breast, if you're pumping milk, expressing milk in whatever way that you can, right? Your body will continue to make milk. If you are not expressing that milk, whether it's, again, direct breastfeeding, pumping, or whatever it is, your body will stop making that milk. We as human beings, especially Black human beings, but we'll go there later, have experienced a lot, famine, all types of stuff. And if our bodies are designed to only be able to produce milk when we are heartily nutritionized, I hope that's a word, we would have died off by now. So I do want to take the time just to address that, because it's very important for us to know, like, while it is important to feed and nourish yourself in those ways, again, nourish our seeds, all of that, it's not directly linked to your milk production. It will, if you're hungry, you'll probably be sleepy. So that means now you're feeding baby less. So again, that can decrease how often you're feeding your baby, which decreases how often you're expressing that milk, and that can affect your milk supply. But nutrition itself is not directly linked to milk supply, if that makes sense.
Yeah, so Taylor is absolutely right. There are some foods that have found to kind of be, cause the baby some gas or something like that. And then there, some acidic foods like anything with like tomatoes in it, like pizza, spaghetti, that type of stuff can kind of cause the baby to be a little gassy and irritable. But that, there's no science behind any one type of food that is going to help with the milk supply. So she's spot on. That's it. You got it, girl. You're gonna be there. You're gonna be there. We're gonna get y'all there. There was a question, let me go to it. Okay, so Marilyn Thomas says, she asks, can you define the acronym IBCLC? How do they differ from a doula? And how could a client best utilize both? So this is a jam-packed question, and I'm gonna try to answer it as simple as possible. So the acronym IBCLC is International Board Certified Lactation Consultant. This is the highest tier credential in the lactation field. And I hold that title, yes. I worked hard for that. So basically any comprehensive lactations, support that a mom needs postpartum or even prenatally to identify risk factors and all of that, I would be able to, provide that care. Taylor and Shamika, if I'm not mistaken, and maybe Autumn. Autumn, are you a CLC?
I am not. I want to be. That's like my next goal. I teach about breastfeeding, but I have neither of those credentials yet.
So
yet.
I got you. Don't worry. So a CLC is a certified lactation counselor. There's also a certified breastfeeding specialist, so CBS. So there's more like, they can assist with latch. They can help with, knowing how to pump and all of that stuff. But if there's anything specific like mastitis or maybe the baby has a tongue tie, those type of comprehensive things, then they would need to yield to an IBCLC. The second part of the question is a doula. So y'all answer how the doula, what you guys provide in the general definition of a doula. Can y'all answer that?
Taylor, you want me to tap this? So as a doula, first of all, let me say, a doula isn't just necessarily limited to one leg. And I say that because I ran across on even just social media alone, doulas who are like fully loaded clips. Like they have so many credentials under their belt. It's not even funny. Herbalist, baby belly binding. Some of them do help with fertility. And so I don't want you to meet a doula and say, oh, well, you're only here for my birth. Start searching they packages, they pages, like get nosy with it, because you will be amazed of the person that's standing in front of you and all the credentials that they have, especially BIPOC, okay? It's a lot of us everywhere amongst the states, in the South, heavy in New York, like it's a lot of us, and all of them have so many ways to help you get to a happy birth, a healthier birth, labor, delivery, postpartum, fertility, and bereavement, okay? Yeah, so when you look for one of the biggest things, first of all, always do your research on everything. I would love to say that. Do your research from head to toe. I ain't gonna say jump down a rabbit hole and get crazy and drive yourself to a psych ward. No. Find what you are looking for and really see how far it expands out to. If you're, say, looking for a South Carolina doula, look for the doulas in that area that's closest to you. And again, look into those packages they come with and see what works best for you. So now let me hone in on it more. Find the person, your birthing team, your postpartum team that aligns. Let me run it back. Aligns with you, Taylor, but aligns. You got to understand how important that is. Don't be just getting everybody. I'll say this because this is as my business is called New Birth Journey, this is your birth journey. So what happens is a lot of people have stories, and part of the story is they met a doctor they wasn't feeling from the start, but they stuck with them. They met, maybe a doula or IBCOC or whoever that they didn't, they wasn't really feeling, got funny vibes, that they felt like, this is all I got in my area. I'm gonna just stay here. I don't feel like looking. Don't do that. This is your body. This is about you. Be sane, be selfish, be specific on what you want and what you're trying to do. Because at the end of the day, this is a life and death matter. Don't play with your life. Don't play with that baby life. This is serious, because at the end of the day, if you're not suited with not just the tools, but the people that's around that you have access to, you are at a higher risk. And I'm sorry, we're sick of losing our Black women every other day, okay? We have also some fathers, if you look for Kira, for moms, that is a story to look into. I wanna say her name is Shayasia. That's another story to look into. Yes, I didn't wanna say her name wrong. And Bruce McIntyre, which I got to work at, Bruce McIntyre III, he always correct me, but I got to work with him often, but even looking up his name, advocating for their wives, their fiancés, who are Black women who have passed on due to some level of medical malpractice. There's also, I believe, if you want to look further into, I want to say there is an OBGYN or a midwife that has passed away in childbirth. At some point, and I forgot her name, forgive me for that, but that is another story to look into. But we are 3 to 4 times more likely to die in these birthing rooms. Hold on, so I just was reading about how we're more likely to have a heart attack. Oh, okay, so this is not the time to play with your life or that baby's life. Get you and your family, your friends, whoever you trust with your life together. So now let's go back into what is a doula. We're here to support you on your journey. And I keep highlighting and emphasizing you because you have rights. You have rights in that birthing room. If you don't want to do 15 million cervical checks, don't do them. If you don't want to birth in a hospital, don't do it. If you want to have a home birth, do that. Look for your home birth midwives. Like, look into, if you want to take your placenta home, okay, in Connecticut, we have Shakti, who is the placenta encapsulator. If you want to take it home, okay, take it home, it's yours. Don't let them people argue with you about what's yours. If you want to have a lotus birth, which is you leave the placenta attached until it falls off on its own, so your baby could get everything. Hold on, it logged me out somehow. I'm coming back. Hold on.
You in there? We got you.
Okay. I thought it took me out. But if you want to do that because this is your journey. This is your time. So you want to find a doula, again, that aligns with you. Not just a doula. You want to find an IBCOC that aligns with you. You want to find some doulas, as myself and Taylor, who are also COCs, that aligns with you, especially in our urban communities. Don't be afraid to ask your doctor, because if you want to see doulas pop up more, start the conversation. And how you can help us start the conversations when you're looking at that midwife and that doctor, say, hey, do you know a doula? Do you know an IBCOC? You got a business card? Connect me with them. Could you send me an email or their information? Because now it gives that doctor, that midwife, that OBGYN a job to go ahead and try to look who on that directory, who can they talk to? And I swear they will run very fast to some of these groups that we have on our Facebooks and social medias, where we'll have like a birth professional group just for us, where they'll run in there like, I'm looking for, and I need somebody pass me a reference to. Yeah, how we get the work done is by doing the work. And sometimes we need that client to medical professional direct communication line to get some of that fire under their behinds in a sense. And to start, when it's a higher request and demand for it, then it starts to get them to move to want to do it. Not just them, but the legislative boards as well, because now the doctors and the surgeons and the OBGYNs and the CNMs and the home birth, they got to go back and start it. Word of mouth is everything. So they got to go back and start saying, they just keep asking for them. They're all over the world just asking for them. So we need to start figuring out how to get them doulas under insurance, because for most part, it's very slim to none. It's only a couple states that have doulas that are insured. I'm sorry, am I talking too much? Yeah, but there are some doulas that have that can get insured, but even that is levels to it, because you may not have access to all the people that's in that state. It may be limited to one or two organizations or whatsoever, which once they're used up, then you got to go and keep searching for more. But the more and more the demand increases, the louder and louder the voice is, the more and more pressure is applied. What is it? Pressure makes diamonds. So you ain't gonna get that diamond until we work together to apply that pressure. Because we're working from the inside, which is from the hospitals, from the, our local offices, etc., our local collectives as well. We're working from the inside out and trying to be like, hey, these clients need this. These people need this support. And for a lot of having a doula, when you have a birth doula, you can have her doing your laundry, okay? You can have her sweeping one or two floors, maybe tidying up some toys before that baby gets here, so you can just relax. Why you want to do so much? This is what we're here for. The help is here. It's not a bougie thing. This ain't, just mind me when I say this. This is not just a white people thing. Like, it's not that. This is very much a birthing body thing. If you can find, I don't care if you want an LGBT doula, a green doula, purple doula, there is like a deaf doula who does ASL. Like, it's all kind of doulas out here that's like, listen, I'm here to help. There are courses. Some of these doulas, as Taylor has her course to look into to help getting you prepared. Everything is stuff on YouTube, yes, but how do you start filtering that out and finding what works for you, unless you start communicating and really getting that one-on-one with someone? Pay for a consultation. Some of our consultations is like $20 just to sit down and talk to us for an hour. Like, go ahead. Put a doula on a baby registry. Hey, y'all, I know I set up Target, but I'm gonna need y'all to gather up a good 300, 400, 500, whatever the case may be, so I can have a doula, because I want one. Even if it's not for your birth, but your postpartum. I don't care if you have a postpartum baby shower. Like, add one. Because at the end of the day, outside of them diapers and the wipes that you may need, and all them 50 other items that you may not use, what you can use is that doula. Birth, postpartum, fertility, or whatever else that doula may come with, herbalism, belly binding, and it's so many, especially different cultures, different backgrounds, even outside the country. Outside the country, a lot of, I want to say even in Europe, that's a part of their insurance. And I had to do a research study on France, and that's like a part of the package is to have a doula. Like, so if it's mandatory outside, you got to start thinking about what's happening here on the grass we stand on. Why is it mandatory over there? Oh no, we got to do something about this, especially for our BIPOC, all of us. If it don't matter, our BIPOC, period. And this is the time, especially during these Black Maternal Health Weeks, there's so many Zooms going on, videos, and all kind of stuff. Listen to them, take a view at them, connect with these people, tap into them. Even if you got 30 minutes, save the video and watch it later. At the end of the day, you want to suit yourself up to feel confident and feel good. You want to walk in there like, listen, you're not about to tell me anything, okay? I'm about to have this baby, and I'm going to get close to what I need and what I would like, because you start thinking about that after story when you had done had the baby. You start thinking about, dang, that doctor was really mean, or that nurse didn't hear nothing I said, or I was really trying to use my voice, but sheesh, I didn't understand some of the things that they say. Sometimes we do shy away from all that medical jargon. And we're like, what you just say? It's, first of all, don't get embarrassed if you got to say, hey, I didn't really understand that. Could you break that down? If they give you, as Autumn talked about, that defense stuff going on, that, well, all right, in 10 minutes, I'll explain to you. No, I don't have 10 minutes. Explain to me now. Why you can't explain to me now? Matter of fact, those discharge papers and all them long 4 or 5 sheets, they like to, after your visit, they want to hand it to you. Read those. Read those. I know everybody don't want to read them. Read it. Why? And get you a highlighter. And then things that don't make sense, grab that journal, write in that journal, and bring it back and say, hey, you said this last week, and I got some questions this week, and I need to know. And if you get in that, well, gosh, your appointment is only 45 minutes. You have time to move on to the next doctor, next midwife, next anybody and everybody. You can change them at the last minute. Did you know that? You can change them. You can ask for the head person in charge and sure enough say, this person is not making me feel comfortable. I cannot give birth in a space that I don't feel comfortable. But these are the things also that your doula is going to sit there and be like, listen, my client do not feel comfortable with this. What can we do? Okay. And before they agree to anything, how can we use brain, Autumn? How can we use brain and evaluate the risk? What happens if I choose not to do anything? Like, or who else can I get a second opinion? Can we ask somebody else on the floor? And before you even go into that birthing room, get familiar with the floor. Hey, I'm just here to visit, see what your birthing floor looks like so I can know where your nearest bathroom is, your nearest this. But I also want to get an idea who's going to be my nurse on Mondays, who's going to be my nurse on Tuesdays. Let me get familiar with the staff. Do your staff interchange a lot? Like, get familiar. Yeah, they may feel like this person is nosy. Okay, but you're getting paid by me. Because at the end of the day, your insurance is taking your money out your pocket and paying these people. And what happens is if you don't pay the insurance, they don't get paid. So they may feel like, oh my goodness, they asking me 50,000 questions. But again, what I say, you're in between life and death. Okay, don't play with yourself. Don't do that. Why would you want to do that? You want to suit yourself up as much as possible. This is real. This is real. There, especially if you hemorrhage, especially if you have placenta previa, especially if you're going through gestational diabetes. How many of us actually question the little orange glucose drink? Oh, do I have to drink that? Why can't you just draw my blood? Why can't you just use a urine sample? There's other ways to look at things. Did you know that? But this is what the doula will educate you on, suit you up for. Don't just let them people, especially for us, go in there and dumb you down as Black, brown people or BIPOC. Don't let them dumb you down and make you feel ignorant and foolish. Don't let them do that to you. Go in there and really feel like I'm gonna ask questions. And as Taylor was talking about before with the co-parenting, with the dads being in the room, dad, ask the question. You come in with a notebook too. Ask the question. My wife wanna know. No, because I want to know where you taking my baby to in this next room. No, did we consent to that? No, because before we got here, she ain't say she want all these vaginal exams. What you doing to her? Like, yes, ask. And then I'm gonna tell you something. As a woman, as a person who gave birth, as a partner. When we hear them dads speaking up, we be like, okay. And if you want to talk about breast milk flowing because dad's in the room, yeah. All right. Okay.
Shamika, you are like on 10 right now, and we are right there with you. The comments is blowing up. They are loving it, and it's so needed. It's like, get it together, okay? We got to do this. We got to save ourselves, and we need to get informed. So I want to address a question in regards to breastfeeding. So Candace Mabry, forgive me if I said it wrong. She asked, so pumping in between feedings can help with the flow of it longer until I want to stop? That's her question. I'm loading baby number 3, so I'm assuming she's expecting, and she wants to nurse much longer than her first 2 children. So this is why it's helpful to have a CLC or an IBCLC. The CLC is a certified lactation counselor. IBCLC is International Board Certified Lactation Consultant. Lactation consultant, lactation counselor, right? Have somebody that is educated in breastfeeding to help support your goals, whatever it is. So it's hard to answer this question because I don't know your history, right? We need to know your history. We need to know, do you have any risk factors? What was the reason why you didn't breastfeed your other 2 children? It's more than just a straightforward question. Breastfeeding is not that straightforward. It's not. It's it can be layered. So what I will say is if the baby's coming to the breast frequently, you don't need to pump necessarily unless you have some engorgement or some of those things. If you want to relieve engorgement, you can pump in between to relieve the engorgement if the baby's sleeping or something like that. But if the baby's coming to the breast frequently, I would not advise you to pump, to pump as frequently as you're breastfeeding, because then you can put yourself into oversupply and be at risk for mastitis and plugged ducts and stuff. So if you're pregnant, take a breastfeeding class. I offer breastfeeding classes, and we're going to put our information in the chat. Y'all tag yourselves in the chat so that folks can find you. So I offer prenatal breastfeeding classes. I believe Taylor and Shamika does as well. And then Autumn touches on it as well as a childbirth educator. So y'all get educated. Reach out to folks. We're here. We want to support you. If you see a post, don't just fly by it. Go and actually inquire. Reach out to us. I'm very available through Messenger. Like, you just hit me up. So if you want to take a breastfeeding class, it's virtual. You can do that, so you can learn more about how you can better have a more positive breastfeeding journey this time around versus your last 2 children. I wanted to pin that comment. So she's definitely looking into taking a class. So that's awesome. Definitely check, get your classes, build your team. So this is what the team could look like, right? Women of color, providers of color, right? You have Autumn, she's a childbirth educator and a licensed clinical social worker. You have doulas that are also certified lactation counselors that can support you prenatally during your birth and in the postpartum period, and also give you that all of what a doula entails, but give you that lactation piece, because they're on the front lines. I'm not going to be there right after you deliver. I'm not, because I'm not a doula. I'm going to leave it to them, right? So I'm not going to be there. You won't see me until maybe 4, 5, 6 days later. So it's imperative that doulas get educated. So if there's some doulas on, you want to get some lactation education and get some certification so that you can help support these women on their breastfeeding journeys too. So yeah, we can get on the moms, but we got to get on some of these providers as well, right? The doulas and folks that are helping on the front line. And yeah, take a class if you want. So I think that's all the questions. And I don't see any more. I don't. I think it was more comments and everything, and everybody was really excited to have us on. And I believe Marilyn said there needs to be a part 2, and I'm like, all of what I had to do to get on here, I don't know. I don't know, but I would love to do it maybe on someone else's platform. Okay, I'll leave it to y'all. But yeah, let's convene. I'm gonna close out, and I'm really excited to have you ladies participate. This was amazing, and they loved it. So yeah. So we're gonna head out, and I think that's it. I don't think anybody else has questions. So, all right, we're gonna put our information in the chat, and y'all hit us up, and include the services that y'all offer too. Okay, just put your links, put your websites, your IGs, and everything in the chat. All right, thank you.